I'm going to be talking about the different types of dressings that you may have with your surgery and also wound care. Once you're home the day after surgery, we want you to shower. You need to remove your garments to do so. On this mannequin, I show all the 3 different types of dressings that you may have at the discretion of your doctor based on your procedure or your skin sensitivity. This first dressing here is a white gauze, which you will remove to shower. Underneath the gauze, you will find a steri strip over your incision. You leave the steri strip in place and wash gently, dabbing with soap and water. Rinse, pat dry with a clean towel, and apply a clean dressing over top. Your second dressing, you're not able to see it, but there is a steri strip over your incision with a folded 4x4 and a clear transparent dressing. You will do nothing with this dressing. You'll wash over it normal, gently with soap and water. If the edges begin to peel up, it starts to get wet under the dressing at all, at that point you may remove it. Otherwise you leave it in place until your post-op appointment. The third dressing is again white gauze. Underneath the white gauze is a yellow greasy gauze. You will remove this as well. Wash, gently patting with soap and water over the incision. Pat dry with a clean towel. On this incision, since there is no steri strip, you will apply bacitracin ointment all along your incision, just enough to keep it a little bit greasy. If you get any scabs or crusts on the incision, you take a soppy, wet, warm washcloth, soak it on there for 5 to 10 minutes to soften the scabs and crusts, and you can gently clean them away prior to putting the ointment on. Keeping it a little bit greasy and keeping it clean will also keep those scabs and crusts away. Then you apply a clean dressing back over your incision. And if you have garments, then you will reapply your garments. The bacitracin that I'm mentioning in this video, we prefer that over an ointment like Neosporin, as more people have a likely chance of reacting to that ointment. We do sell the bacitracin here. You can also get it at any pharmacy or Kroger. They sell it in the same section as some of those other ointments. But we prefer that you use that just to not have a reaction. Your incisions may become a little bit red. That's normal after surgery. You can use Kotex pads as dressings or 4x4s, which you can also purchase at the store. You want to stay out of a swimming pool, pond, lake, hot tub for 4 weeks to minimize your risk of infection. And that is the explanation of wound care and how to all different types of dressings.